All right, guys, last exam. So let's do a quick review. If you've looked at the outline review and worked on some of the questions there, looked at the functions of those, the androgens, ADH, glucagon, the glycochlorides, insulin, thyroid, aldosterone. All right, know the functions of those and what secretes them. So what comes from the anterior pituitary gland and the posterior pituitary gland. All right, so which hormones come from each of those? All right, a couple other things, combining some of the chapters, is who's at greatest risk for hypertension? Who's at greatest risk for diabetes? Who's at greatest risk for testicular cancer? All right, so just recognizing the patients, and then also recognizing if you had 4 patients who has, looking at their blood pressures, who's orthostatic, who's hypertensive, who's hypotensive. All right, what is orthostatic hypertension? All right, diabetes, again, what's the purpose of the insulin and of the pancreas? Where is glucagon stored? What's the purpose of beta cells? What is the definition of diabetes? Type 1, type 2. All right, recognizing how do we detect if it's type 1 or type 2? What are they looking for? Okay, we're going to look for the islet of Langerhans, right? If there's beta cell destruction, it's going to be type 1. It's autoimmune. When does, what are some risk factors for diabetes type 2? What can we do to help prevent it? All right, what are hemoglobin A1C? I know we spoke about it. So breaking it down a little bit more, your hemoglobin A1C tells how much sugar is attached to a red blood cell, and it's tested every 3 months. So every 3 months, it tells how much sugar is actually attached to a red blood cell. All right, what's hyperglycemia? What's hypoglycemia? What is some clinical manifestations for hypoglycemia or hyperglycemia? What do we do? And what are our nursing interventions for that? What are the 3 manifestations associated with diabetes? What is a glucose tolerance test, and what's the purpose of it? What does it tell us? And who do we give it to? What Addison's disease? Okay, what is that? What is it? What's it lacking? What's it needed? Cushing's disease. What is Cushing's disease? What is the reasons people get Cushing's disease? What are our clinical manifestations for both of those? All right, what's Graves' disease? What are some clinical manifestations with Graves' disease? What is it? Okay, what do we expect to see? What are hormones? What's the purpose? What's the purpose of our thyroid hormone? Computer. All right, recognizing people who come in to see you and they tell you, I have this, this, and this, and is it neuropathy? Is it, what's going on, listening to what their signs and symptoms are, or what's going on. And what is neuropathy? And how do we educate our patients with neuropathy? What does glucose do for our body? And what happens when we have too much glucose in there? Does the arteries stay nice and thin and fluid, or do they get thick? Okay, what happens, and then how do we educate our patients on it? Clinical manifestations of PCOS. What type of menstrual cycle would we have if we had PCOS, or our patient had PCOS? Would it be our normal 21 to 28 days? Would it be, every other month? What's their normal menstrual cycle? Okay, what are the clinical manifestations? We spoke about it, that you would see with somebody with PCOS. If they were trying to have a baby, if they were trying to get pregnant, what would they try to do? What would medications that would take? Testicular cancer. Okay, what was the major risk factor? All right. What is the clinical manifestations of testicular cancer? And BPH. Okay, and what is one of the pharmacological treatments of BPH? We're talking about BPH, we want to make sure they don't get urinary retention. So do you think that would be one of the main pharmacological treatments that they would have be given, is to make sure we don't get urinary retention, right? Because you want to make sure that they're still able to go to the bathroom. Why do we have bone loss with menopause? What could we do for that? What is the cause of PCOS? What is the ovarian cancer? Are there any clinical manifestations, or is it pretty much asymptomatic? If a patient comes to the hospital and they have that bloating or that pelvic pain, could that be an indication of ovarian cancer? What is FSH and LH? Where is it produced? Okay. Which pituitary gland, anterior or posterior? What are some risk factors for erectile dysfunction? And when it comes to menopause, what systems are affected? Just the reproductive, or does it affect more symptoms? SIADH is caused by what? Okay, again. What's a risk factor for ovarian cancer? Again, clinical manifestations. Prostate cancer. What are some clinical manifestations of prostate cancer? And what's the treatment? Clinical manifestations of an MI. What are some clinical manifestations when we see people with a myocardial infarction? And a stroke. What are some clinical manifestations of a stroke? And we'll discuss that in the morning. Diabetes insipidus, what does it present as? Okay. What do we show? Some of our complications. Fasting blood sugar. If we do a fasting blood sugar, and what is an indicator of diabetes? What is it going to be greater of? Greater than. Okay, and it's in that chart in our chapter 20 book. So know the difference between type 1, type 2, gestational. Hemoglobin A1C, what's the role of insulin? What's the role of glucose? Okay, and then the hormones. If you did the outline, kind of went through and answered some of the questions, and then kind of listen to this, it'll help guide you in that right direction, okay? So lots of clinical manifestations of the different diseases that we spoke about. All right, and we will answer questions tomorrow.